You are going about your normal day when a slip, a fall, or a stray elbow shatters the symmetry of your face. A loud crack, and you are left with a visible gap that dictates how you'll interact with everyone you meet. Take Ahmed, a sales manager living in Muscat. A minor sports accident knocked out one of his front teeth right in the middle of his busiest financial quarter. For someone whose livelihood depends on face-to-face meetings and presentations, walking into a boardroom with a highly visible gap feels paralyzing. The physical loss of a tooth is often overshadowed by the social handicap it creates. That gap becomes a source of immediate anxiety, turning a dental injury into an urgent professional crisis. For decades, the standard medical fix for this problem has been a traditional dental implant. This diagram outlines the traditional process. Notice the timeline. You undergo one surgery to place a titanium post, wait 3 to 6 months for the bone to heal, and then return for a second surgery just to get your actual tooth attached. To hide the gap during that long wait, patients are handed a removable plastic flipper, an uncomfortable, temporary denture that often makes speaking and eating difficult. You are effectively asked to put your professional life and self-esteem on pause while you wait for your biology to catch up. The traditional method restores the structural integrity of your bite in the long run, but it fails to address the immediate psychological damage of walking around with a missing tooth. To fix this delay, specialized clinics have developed immediate-load dental implants, better known as same-day implants. By using advanced 3D imaging and surgical guides, specialists are compressing half a year of waiting into a single visit. In that one compressed day, the dentist extracts the root, inserts a titanium post, and attaches a crown simultaneously. The American Dental Association notes that when performed on ideal candidates, this accelerated method boasts a success rate of up to 98%. Modern dentistry has taken a multi-step surgical marathon and condensed it into a routine morning appointment. If this accelerated technique works so well, why isn't every patient getting their implants on the exact same day? This cross-section shows the mechanical reality of the procedure. A same-day implant requires a flawless biological foundation to withstand the immediate downward pressure of chewing and speaking without shifting. The primary roadblock is jawbone density. The bone must be thick and robust enough to anchor the titanium post tightly on day 1. If you have suffered bone loss and need a graft first, the same-day option is off the table. You also need exceptionally healthy gums, free of periodontal disease, and a clean bill of overall health. Conditions that impair healing, like uncontrolled diabetes or autoimmune disorders, reduce the chances of success. Your lifestyle plays a major role too. Smoking restricts blood flow to the oral tissues, starving the gums of oxygen and increasing the risk that the implant will fail. No matter how fast or precise the surgical technology gets, the speed of the procedure is bottlenecked by the biological integrity of your own jaw. Fortunately for Ahmed, the sales manager in Muscat, his jawbone and gums were in excellent condition, making him an ideal candidate. He sat down in the specialist's chair and walked out before lunch with a perfectly matched fixed smile. No uncomfortable plastic flippers, and no visible gaps. While the results look finished, the tooth Ahmed received on day 1 is actually a temporary placeholder. This diagram compares the two materials side by side. The crown on the left is engineered from a lighter acrylic. Dentists use this specific material to minimize the pressure placed on the fresh titanium post while you chew. Your body still has to complete a process called osseointegration, where the jawbone cells slowly grow, wrap around, and permanently lock into the metal post. And that invisible healing phase still takes 3 to 6 months to finish. Because the implant is vulnerable during this window, the aftercare is strict. Patients must stick to a soft food diet for 6 to 8 weeks, while strictly avoiding anything that requires hard chewing. Only when that invisible fusion is complete and the foundation is rock solid, does the dentist swap out the light acrylic for a heavy-duty, permanent porcelain crown. Modern technology cannot force the human body to heal any faster than nature intended, but it has finally given us a seamless way to completely hide that long wait from the outside world.